Welcome to Lesson 10, Unlisted, Add-on and Separate Procedure Codes. In this lesson, we'll learn 3 important captain concepts for the CPC exam: unlisted procedure codes, add-on codes, and separate procedure codes. Remember the basic distinction. Unlisted equals no specific code adequately describes the service. Add-on equals an additional service reported with an appropriate primary procedure. Separate procedure equals may be separately reportable when the applicable captain and NCCI rules allow it. We'll also focus on 2026 coding guidelines, documentation, NCCI edits, and common CPC exam traps. Let's begin Lesson 10. Before we begin Lesson 10, Unlisted, Add-on and Separate Procedure Codes, let's review what you'll learn. By the end of this lesson, you should be able to identify when an unlisted captain code is appropriate, understand the reporting concept for add-on codes, and recognize the separate procedure designation. We'll also learn how to distinguish these 3 concepts and apply captain guidelines, code-specific instructions, NCCI edits, and payer requirements when making a coding decision. Here's an important CPC memory. Unlisted means no specific captain code adequately describes the service. Add-on means an additional service that is reported with an appropriate primary procedure. Separate procedure means the service may be separately reportable when performed independently and when the applicable captain and NCCI rules allow it. Our coding workflow is: read the documentation, right pointing arrow, identify the service, right pointing arrow, check captain guidelines, right pointing arrow, check code specific instructions, right pointing arrow, review NCCI and bundling rules, right pointing arrow, verify payer requirements, right pointing arrow, select the code. Remember, coding should never be based simply on what sounds correct. This lesson is provided for educational and CPC exam preparation purposes only. It does not replace the official Captain Codebook, CMS guidance, NCCI policies, payer-specific policies, or professional coding advice. For 2026 coding, always verify the current official guidelines, complete documentation, applicable edits, and payer requirements. Our key takeaway is simple: don't guess the code, verify the guidelines. Now, let's begin our study of unlisted, add-on and separate procedure codes. Now let's understand unlisted procedure codes. An unlisted captain code is used when a performed service or procedure is not accurately described by an existing specific captain code. The key CPC memory is: unlisted equals no specific captain code accurately describes the service. Before selecting an unlisted code, don't simply choose the procedure that sounds closest. First, review the documentation and identify exactly what was performed. Then search the appropriate captain section and review the code descriptors, guidelines, and parenthetical instructions. The next question is critical: does an existing captain code accurately describe the entire service performed? If it does, use the appropriate specific code. If no existing code accurately describes the service, an unlisted procedure code may be appropriate, with the required supporting documentation. Documentation is especially important when reporting unlisted services. The report should provide sufficient information about the procedure and the work performed so the service can be evaluated. Here's the common CPC trap: I can't find the exact procedure, so I'll choose the closest captain code. Not necessarily. Never select a code just because it sounds similar. The code must accurately describe the service. Also remember the difference: unlisted equals no specific code. Add-on equals additional service. Separate procedure equals check whether separate reporting is allowed. For 2026, always verify the current Captain Codebook, Captain Guidelines, CMS and NCCI guidance, code-specific instructions, documentation, and payer requirements. Your final rule is: no specific captain code accurately describes the service, right pointing arrow, consider the appropriate unlisted code. Remember: documentation, right pointing arrow, captain review, right pointing arrow, guidelines, right pointing arrow, verify no accurate specific code, right pointing arrow, unlisted code when appropriate. Now let's learn how to report an unlisted procedure. The first rule is simple: use an unlisted code only when no existing CPT or HCPCS code accurately describes the service performed. Never select a code simply because it is the closest match. Start by reviewing the documentation and identifying exactly what was performed. Next, determine the anatomy, technique, extent, and work involved. Then search the appropriate captain section and carefully review the code descriptors, guidelines, and parenthetical instructions. After that, ask an important question: does an existing specific code accurately describe the service? If the answer is no, select the appropriate unlisted code from the relevant captain section. Supporting documentation is extremely important. The documentation should explain what was performed, why it was performed, how it was performed, and the relevant extent, complexity, time, effort, or equipment involved, as applicable. Here's the common CPC trap. I can't find the exact procedure, so I'll choose the closest captain code. That's wrong. The closest code is not necessarily the correct code. The code must accurately describe the service. For 2026, always use the current captain code set and applicable CPT, CMS, NCCI, and payer guidance. Remember your CPC workflow. Documentation right pointing arrow identify the service right pointing arrow search captain right pointing arrow verify no specific code fits right pointing arrow select the unlisted code right pointing arrow provide supporting documentation. The final rule is, don't guess the closest code, code what is accurately documented and verify the applicable rules. Now let's understand the basic concept of add-on codes. An add-on code describes a service performed in addition to a primary procedure and is generally reported with the appropriate primary procedure. In the Captain Codebook, add-on codes are identified by the plus symbol. The key CPC memory is, add-on equals additional service. Think of it as, primary procedure right pointing arrow additional qualifying service right pointing arrow add-on code. When reporting an add-on code, first identify the primary procedure. Then determine whether the additional service was actually performed and check the specific captain instructions for that add-on code. One important CPC concept is that add-on codes are generally not standalone codes. They are normally reported in addition to their required primary procedure. Here's the common CPC trap. The add-on code describes a service I performed, so I can report it by itself. Usually, that's incorrect. You must first determine which primary procedure is required and verify that the combination meets the captain reporting instructions. Also remember the difference between unlisted and add-on codes. Unlisted equals no specific code accurately describes the service. Add-on equals additional service specifically described by an add-on code. For 2026, always verify the current captain code descriptor, parenthetical instructions, add-on guidelines, NCCI edits, and payer requirements. Your CPC workflow is, red documentation right pointing arrow identify primary procedure right pointing arrow identify additional service right pointing arrow look for the plus code right pointing arrow red code specific instructions right pointing arrow verify the required primary code right pointing arrow report the add-on when appropriate. Remember the final rule. Add-on code equals additional qualifying service plus required primary procedure. Always follow the specific captain instructions rather than assuming that every additional service qualifies as an add-on code. Now let's understand the add-on code symbol and captain guidelines. In the Captain Codebook, an add-on code is identified by the plus symbol. Remember, plus equals add-on code. When you see the plus symbol, don't stop at the code descriptor. Check the captain guidelines, parenthetical instructions, code-specific requirements, and applicable NCCI or payer rules. Not every service performed in addition to a primary procedure is automatically an add-on. The code must be designated as an add-on code, and its specific reporting requirements must be satisfied. The common CPC trap is thinking, the service was performed in addition to the main procedure, so I can use any add-on code. That's incorrect. Your workflow is, see the plus symbol right pointing arrow read the descriptor right pointing arrow check captain instructions right pointing arrow verify the primary procedure right pointing arrow check NCCI and payer rules right pointing arrow report when requirements are met. For 2026, always verify the current captain instructions and applicable CMS NCCI and payer requirements. Final rule. The plus tells you it's an add-on code, the captain instructions tell you how to report it. Now let's look at some of the most common CPC exam traps involving add-on codes. Trap number 1. Reporting an add-on code by itself. An add-on code is generally reported in addition to an appropriate primary procedure, so always check the required primary service first. Trap number 2. Assuming every additional service is an add-on. Just because a service was performed in addition to another procedure does not automatically make it an add-on code. The CPT code itself must be designated as an add-on code and its reporting requirements must be satisfied. Trap number 3. Ignoring the primary code requirement. Some add-on codes have specific primary code requirements. For Medicare, CMS categorizes add-on codes as Type 1, Type 2, or Type 3, so the applicable primary code rules must be reviewed. Trap number 4. Ignoring NCCI add-on code edits. For Medicare, applicable NCCI rules must be checked to determine whether the required primary procedure is present and whether the add-on code can be appropriately reported. Trap number 5. Using a modifier simply to bypass an edit. Never add a modifier just because an add-on code is being denied. A modifier should be used only when the clinical circumstances and applicable coding requirements support it. Here's your CPC quick memory. Plus symbol right pointing arrow identify primary procedure right pointing arrow read captain instructions right pointing arrow check NCCI AOC edits right pointing arrow verify documentation right pointing arrow report when requirements are met. For 2026, remember that CMS updates its Medicare add-on code edits, so always use the current applicable edit files and guidance. The final CPC rule is, don't just see the plus, check the primary code, captain instructions, NCCI edits, and documentation. Remember, add-on does not mean standalone. Additional service does not automatically mean add-on. Modifier does not automatically override an edit. Understanding these traps will help you avoid common errors on the CPC exam. Now let's understand the separate procedure concept. A captain code designated as separate procedure represents a procedure that may be reported separately when it is performed independently or when the circumstances support separate reporting. The most important CPC memory is, separate procedure does not mean automatically separate. When you see this designation, you need to evaluate the circumstances and the applicable coding rules. Start by identifying the procedure. Then check whether the code is designated as a separate procedure. Next ask, was the procedure performed independently? Then review the captain guidelines and code-specific instructions, followed by applicable NCCI and bundling rules. If the procedure is an integral or included component of another more comprehensive service, separate reporting may not be appropriate. Here's the common CPC trap. The captain descriptor says separate procedure, so I can always report it separately. That's incorrect. The designation does not automatically override bundling rules. For example, if a procedure designated as a separate procedure is performed during the same operative session as a more comprehensive procedure, you must determine whether it is actually integral to that comprehensive service. Now compare the three concepts. Unlisted equals no specific code accurately describes the service. Add-on equals additional qualifying service reported with an appropriate primary procedure. Separate procedure equals check whether separate reporting is allowed. Your CPC workflow is documentation right pointing arrow captain designation right pointing arrow procedure relationship right pointing arrow NCCI and bundling check right pointing arrow payer rules right pointing arrow separate reporting when supported. For 2026, always verify the current captain codebook, captain guidelines, code-specific instructions, CMS NCCI edits, and payer requirements. Remember the final rule. Separate procedure means check the circumstances, not report separately every time. Understanding this distinction is essential for avoiding incorrect unbundling on the CPC exam. Now let's compare three important captain concepts: unlisted, add-on, and separate procedure. First, unlisted. Think. Unlisted equals no accurate specific code. An unlisted code is considered when no existing specific captain code accurately describes the service performed. Next, add-on. Think. Add-on equals additional service. An add-on code is identified by the plus symbol and is generally reported in addition to an appropriate primary procedure, according to the code's specific instructions. Finally, separate procedure. Think. Separate procedure equals check the circumstances. A separate procedure designation does not mean the service should automatically be reported separately. You must determine whether separate reporting is supported by the circumstances and applicable coding rules. Here's a quick decision guide. If no accurate specific code exists, think unlisted. If there is an additional qualifying service with an appropriate primary procedure, think add-on. If the code is marked separate procedure, check whether the service was independently reportable. Here's the common CPC trap. These three concepts all mean the procedure can be reported separately. That's incorrect. They represent three different coding concepts. Your CPC workflow is documentation right pointing arrow captain guidelines right pointing arrow CODE specific instructions right pointing arrow NCCI and bundling right pointing arrow payer requirements right pointing arrow report only when supported. Remember this simple memory. Unlisted equals no code. Add-on equals additional code. Separate procedure equals check separate reporting. For 2026, always verify the current Captain Codebook, Captain Guidelines, CMS NCCI edits, documentation, and payer requirements. The final rule is, don't guess the code. Understand the code designation and verify the reporting rules. This distinction is especially important for avoiding unbundling and incorrect code selection on the CPC exam. Now let's focus on an important 2026 coding point: CPT guidelines, NCCI, and bundling. The most important rule is, verify current information before you code. First, check the current Captain instructions. Review the code descriptor, Captain guidelines, symbols, parenthetical instructions, and any applicable cross-references. Second, check NCCI edits. CMS's National Correct Coding Initiative helps identify code combinations that may not be appropriately reported together. For applicable services, review PTP, MUE, and add-on code edits. Third, check bundling. Ask yourself, is this service already included in another, more comprehensive procedure? Do not automatically report every documented component as a separate code. Fourth, check procedure-specific rules. Some codes have specific primary procedure requirements, add-on instructions, separate procedure instructions, exclusions, or modifier requirements. Here's the common CPC trap. The procedure was documented, so I can report it separately. Not necessarily. Documentation that a service occurred does not automatically mean that it is separately reportable. You must also determine whether the Captain Guidelines, NCCI edits, bundling rules, and procedure-specific instructions support separate reporting. For 2026, remember that CMS NCCI files are updated during the year. Always use the most current applicable NCCI files and guidance. Your CPC workflow is: documentation right pointing arrow current Captain Guidelines right pointing arrow CODE specific instructions right pointing arrow NCCI PTP, MUE, and AOC check right pointing arrow bundling check right pointing arrow procedure specific rules right pointing arrow select and report the supported code. And remember your final rule: don't code from memory, verify the current rules. Current Captain right pointing arrow NCCI right pointing arrow bundling right pointing arrow procedure specific rules right pointing arrow documentation right pointing arrow correct reporting. This verification process is essential for accurate coding and for avoiding common CPC exam errors. Now let's apply what we've learned to a CPC scenario combining unlisted, add-on, and separate procedure concepts. During a surgical encounter, the operative report documents 3 different services. Service A is a procedure for which no specific Captain code accurately describes the service. In this situation, after reviewing the Captain code set and applicable guidelines, the appropriate unlisted code may be reported with supporting documentation. Service B is an additional service specifically represented by a Captain add-on code, and the required primary procedure was also performed. In this case, the appropriate add-on code may be reported according to its specific Captain instructions. Service C is designated as a separate procedure, but it was performed during the same encounter as a more comprehensive procedure in the same related area. Should we automatically report it separately? No. We must determine whether the service is integral to the more comprehensive procedure and review the applicable Captain and NCCI rules before reporting it separately. Now here's the common CPC trap. All 3 procedures are documented, so all 3 can be reported separately. That's incorrect. Documentation tells us what was performed, but it does not automatically determine what is separately reportable. Use this workflow. Documentation right pointing arrow Captain Guidelines right pointing arrow CODE specific instructions right pointing arrow primary and add-on requirements right pointing arrow NCCI and bundling right pointing arrow procedure specific rules right pointing arrow payer requirements. Remember your exam memory. Unlisted equals no accurate specific code. Add-on equals additional service plus required primary procedure. Separate procedure equals check whether separate reporting is supported. And the most important CPC question is, don't ask only, was it performed? Ask, is it correctly reportable? That distinction can help you avoid unbundling and incorrect code selection on the CPC exam. Let's summarize Lesson 10, Unlisted, Add-on and Separate Procedure Codes. First, unlisted procedure codes. Remember, unlisted equals no accurate specific code. When no existing Captain code accurately describes the service, review the appropriate unlisted code and provide the supporting documentation required. Next, add-on codes. Remember, add-on equals additional service plus primary procedure. Look for the plus symbol, review the individual code's instructions, and verify that the required primary procedure has been reported. Finally, separate procedure. Remember, separate procedure equals check before separate reporting. A separate procedure designation does not automatically mean the service should be reported separately. Determine whether it was performed independently and review applicable CPT, NCCI, and bundling rules. Now let's review the major CPC traps. Don't assume that the closest code is correct when no exact code is found. Don't report an add-on code alone without checking its primary procedure requirements. Don't assume that a separate procedure designation automatically permits separate reporting. And don't assume that documentation alone makes a service separately reportable. Your 2026 CPC coding workflow is: documentation right pointing arrow current captain descriptor and guidelines right pointing arrow CODE specific instructions right pointing arrow primary and add-on relationship right pointing arrow NCCI check right pointing arrow bundling check right pointing arrow procedure specific and payer rules right pointing arrow select and report the supported code. The ultimate CPC memory is: unlisted equals no accurate specific code. Add-on equals additional service plus primary procedure. Separate procedure equals check whether separate reporting is supported. And remember the final rule: don't just ask, was it performed? Ask, is it correctly reportable? For 2026, always verify the current Captain Codebook, Captain Guidelines, CMS NCCI edits, code-specific instructions, documentation, and payer requirements before final code selection. Excellent work. Lesson 10 is complete.